back to Fox 43 AM Live. Join us now is Dr. Nicole Trabuck with Wainwright Eye Care. Good morning. Happy to have you on the show. You know, it being January, kind of the new year, new you type of mentality a lot of people have. I know a lot of us are looking for improvements in our lives, and a lot of people have gone, I think, this year with troubles in their vision, hindering their way of life. And this is where you kind of step in now. So I understand you've been an optometrist for over 10 years, and recently you've started providing services for people with kind of chronic headaches, dizziness, and vision that just doesn't seem, I guess, right. So at what point is somebody kind of with poor vision, should they be coming to you now?
Yeah, so I started doing this type of work a couple of years ago. And typically when I see a patient with this type of vision problem, they've already been to several other providers, not just in eye care, but they've been to their primary care doctor, maybe even neurology, and they just feel like they're still having chronic headaches and dizziness, and they're looking for something more. And so the exam that I do is a lot more in depth on how the eyes are working together or not, and how we can correct that to provide relief.
Okay, and I understand that you guys have like a little test that people can take to maybe help them go in your direction. Is that right?
Yes, yes. So on our website, there's a survey. It's free, and they take this questionnaire to kind of decide if they are a good candidate or if there's an ocular component to their headaches and dizziness.
Okay, and I believe, Danny, we do have the QR code if people want to possibly take the test. They're already like kind of like listening to this interview going, I have a lot of headaches. And I looked at the test yesterday. It's very simple. You just kind of answering a couple like yes or no questions about the dizziness and headaches that you may have in your life, and eventually gives you results of saying, hey, you're okay, or well, yeah, how do the results look?
So the results are scored. So 15 or higher is typically a eye component that we can help with. And so after we get the scores back, our office can contact you and see if you would like to schedule a neurovision evaluation.
Okay. And so with this kind of new evaluation, what's been the response from clients? Like how has it been working out for some of them?
That's the best part. It's been really good. So I did my training in Detroit and came back and started doing this, and I've had several people who come to mind that I've really been able to make a difference for them. One is a girl from Wichita that I can think of who doesn't have to take her headache migraine medications anymore. So that's been really such a good thing for her. She's a college student, and if she doesn't have to take medications every day, that's awesome.
That's wonderful.
It's been life-changing for several people. Another woman I can think of, she could not drive on Seth Childs or Fort Riley Boulevard without getting nauseous.
Wow.
She was so dizzy. So we worked with her a lot and her glasses to get her, and now she has that independence back.
Wow,
so,
that's great. Can you speak a little bit of, I guess, what's going on with the eyes that's causing the headaches?
Yes, so around your eyes there's 6 ocular muscles, and they all have to work together with your balance in your brain to feed the brain images that match up perfectly. And when that is not happening, that's where you can get dizziness and headaches that just don't go away, and we don't know why. A lot of times when I'm seeing these patients, they have already had an MRI, they've already been to several providers, so they're just trying to see if there's something else that is there that we can work on and help out any eye components to their symptoms.
That's great. I know it always does seem like headaches are such a mystery for a lot of doctors and the people that are suffering through them. That it's great that there's, I guess, one more potential answer for why people are suffering so much.
Yes, it's been really great.
That's fantastic. And if someone wants to learn more about your services, what's the best way for them to reach out to you?
So on our website, I have a whole tab on binocular vision services and kind of what I do and how I treat it. They can also call the office and talk to any one of our staff members. We have great staff who will look up any insurance questions that they have or let them know what this exam looks like. It's typically longer than a normal exam. It's going to take me usually at least an hour to go get all the data and prescribe it for the person. So.
Wonderful. And if they do start this service and treatment, how long does it kind of take to start seeing results? Does it vary between?
It does a little bit. Usually in the office, because I'm trying it out in the office, I will get some relief for the person. And then after they've started with their glasses and their prism, they will start to notice those benefits as well. I usually have a follow-up appointment with them, and I can make some tweaks if I need to, but also just follow up and see how they're doing, what's gotten better, have I made anything worse, but it's had really great success so far.
Fantastic. Well, it's been such a pleasure chatting with you, and it's great what you're doing out there to helping people, solve one more mystery of their headaches in their lives. It's great, and I hope people will follow up and start to find a little bit of relief this year.
Yeah, thank you so much.
And everyone, please, to learn more, you can visit WainwrightEyeCare.com.